So, hello friends, this is from Chambers, and today we will be starting the second part of our autonomic nervous system, that is the sympathetic nervous system. In the past, we have discussed everything about the parasympathetic system. We have talked about the trucks affecting the parasympathetic system. We have talked about the agonist affecting the parasympathetic system. We have talked about the anticholinergics affecting the and parasympathetic nervous system, isn't it? I was going to tell you anti-nervous system, anti this. Okay, making it a collision. So sympathetic nervous system basically is everything has been taught to you in the first video of ANS. Now, you know your principal neurotransmitter which is working on in the adrenergic system is your endogenous catecholamines. You have endogenous, let me talk about sympathetic. So your sympathetic nervous system is being working on endogenous catecholamines. Endogenous catecholamines. These endogenous catecholamines are epinephrine, norepinephrine, dopamine. Epinephrine, norepinephrine, dopamine. It should be written like this on the note because we have to, before going for INI, CET or NEET PG exam, any entrance exam, USMLE, we will open this and just review it fast. Okay, because we have to review the notes also before the 1 or 2 months before the exam. So epinephrine, norepinephrine, dopamine. Okay. Now, who is secreting norepinephrine? Norepinephrine is secreted by peripheral sympathetic nerve endings. Peripheral sympathetic nerve endings. Epinephrine is secreted by, you all know, adrenal medulla. Adrenal medulla. And dopamine is produced by in the brain also, isn't it? I hope you know this, isn't it? That's why we were talking yesterday about what disease? Which disease were we talking about? DA? Parkinson's disease. Okay. Now see, now once these catecholamines have been produced, they should be exhibiting some sympathetic effects. They should be exhibiting some systemic effects. They should be manipulating the normal physiology. Basically, they are the part of normal physiology, but I'm telling you, changing the physiology. I can't say manipulate, changing, yeah, manipulation equal. So they will be changing the physiology. Uh, to understand this, major site of your neurotransmitter in the sympathetic nervous system, in the autonomic nervous system, is noradrenaline. This is first you have to understand. Fine, fine. Before understanding this concept of a neurotransmitter, I want to give you a brief introduction of biochemistry, that how we are producing this neurotransmitter. How we are producing this neurotransmitter. It's so simple. It's so simple. It's so simple. Fine. Now see, you have, let me make a neuron like this. Everywhere in the medical colleges, they are drawing it like this. Let me take it red because it's an adrenergic neuron. Okay, it's an adrenergic neuron, and this adrenergic neuron, you thought I was make a sandal? No. Okay, don't go in so much imagination. Now this is a neuron. This is your adrenergic neuron. This adrenergic neuron, what it will do, it has to produce what I have to produce. First, there should be a no, there should be a focus where we have what we have to make. We have to make noradrenaline. We have to make, this is the goal. This is the goal, that I have to make noradrenaline. What things I need? I will need substrate plus enzymes. I will need substrate plus enzymes. What is the substrate? Tyrosine. Tyrosine is the amino acid which you will be using. Now tyrosine is present in your blood. Okay, it is present in your blood. Now it will be transported, it will be brought into the cytoplasm of this neuron by transporters, by tyrosine transporter. Tyrosine transporter. This tyrosine transporter will bring this tyrosine and will bring this tyrosine in. Okay, this is your blood vessel and it will bring this tyrosine towards the neuron. Right? Now in the neuron, it will start it will start hydroxylating it. It will start hydroxylating it to form what? Anyone tell me? I will hydroxylate this tyrosine to form dash. I will hydroxylate this tyrosine to form dash. Yes? Why are you so confused? Dopa. L-dopa. Isn't it? I'll be making dopa. You have forgotten everything. Very good, very good, very good. Very nice. Very nice. Dopa. Okay, so you are making dopa. Which enzyme? Tyrosine hydroxylase. Tyrosine hydroxylase. Let me write the enzymes in green. No, not green. Should I write in green? Yeah, should I write in green? Tyrosine hydroxylase. I hope you have forgot everything, isn't it? From the biochemistry. Tyrosine hydroxylase will make dopa. Will make dopa. Okay. Now, if I put an enzyme on the dopa, the enzyme is known as dopa decarboxylase. Dopa decarboxylase. This dopa decarboxylase will convert this dopa to dopamine. Dopa to dopamine. Dopa to dopamine. DA. Dopamine. Now I have to put it. Do we remember that we were putting that in the last, that muscarinic activity? We were putting in those muscarinic neurons, in cholinergic neurons, we were putting it in the vesicles. Do we know vesicles? We were putting the neurotransmitter acetylcholine. Here also I will be putting this in the neurotransmitters in the vesicles. So I will be putting it where? I will be putting it in the vesicles. Okay, storage vesicles. So I will be putting it in the storage vesicles. Fine. I put it in the storage vesicles. Now inside the vesicle, I will be converting this dopamine. I will be converting this dopamine into noradrenaline. In the vesicle, I will be converting this dopamine into noradrenaline. We make it clear. Why it's not working? Okay. Dopamine to noradrenaline. Okay, I converted this. Now it is the time for this noradrenaline. Once you give an appropriate action potential, this neuron, once you have a sympathetic activity, you will stimulate this adrenergic neuron and it will be released. It will fuse and it will be released in this junction. Okay, it will be released. It will be released here and it will act on its receptors. It will act on its receptors. You always used to make like this, isn't it, in the medical school? So this is our post-synaptic region where we have the receptors. So I will make it red also because receptors will act on its own. So I will be having let me make like nice alpha receptor and beta receptor. So they can work on these receptors. Fine. Is there any doubt? First understanding. So you had tyrosine. Tyrosine is converted to dopa by tyrosine hydroxylase. Dopa is converted to dopamine by the enzyme dopa decarboxylase. It's a decarboxylation reaction, one hydroxylation reaction, one decarboxylation reaction produces dopamine, converts into noradrenaline in the vesicles, then fuses to this, and then the vesicle, this neurotransmitter is released on the receptors at the junction. It is working. Okay, fine. Is there any doubt, guys? Is there any doubt? Now, who can tell me the name of that thing which is transporting this dopamine into noradrenaline? I will give him a chocolate and a big dinner once I come back to medical school after Corona. A big dinner, really. He and me, or she and me, anyone. I will arrange a big dinner for them who will answer without using Google. Yeah, Google will not answer, maybe. Okay. Because see, in the Google or in the any search engine, you search anything, but our books say something differently, isn't it? So we want something which is, which we have some international authors which are speaking about that, because medical school we more rely on the books, standard textbooks. So that transporter is known as a very new transporter for you. That is, let me make it a transporter like this. Transporter is called VMAT transporter. This is the VMAT transporter which is bringing this in, which is bringing this in. VMAT2. VMAT2 transporter will bring this into the. So what is a VMAT2 transporter, guys? What is the function of VMAT? What is the meaning of VMAT first? Vesicular monoamine 2 transporter. Vesicular monoamine 2 transporter. Okay, vesicular monoamine 2 transporter. This transporter is not a selective transporter. This is a concept you have to remember. It is non-selective transporter. It is a non-selective transporter, and it is it is non-selective. That means it can transport serotonin as well. It can transport serotonin as well. It can transport serotonin as well. Is it clear? Don't forget, please don't forget, your doctors, don't forget, guys. Don't forget, otherwise it will become a problematic thing, guys. Guys, what's up, guys? Guys, it will be a problem. Don't forget, please. Don't forget, I request you. So let me show you the drugs here only so that you don't forget. So which drugs are inhibiting? Which drugs are inhibiting these enzymes? So if you want to block these regions, if you want to block these regions, will you be using these drugs to inhibit at the enzymatic level, at the substrate level, at the transport level, at the vesicle storage level, at the synaptic release level, isn't it? If you are a doctor and you want to treat, you don't want an adrenergic activity to happen, you will be manipulating, you will try to intervene at some point of this reaction happening, the chart in front of you, so that you can't allow the noradrenaline to be made or not to do its activity. That is the purpose you have to do if you want to block. I am talking about blockers. I'm not talking about agonists. I'm giving you a conceptual thing so that you can relate. There is one thing which is concept. Okay. Now listen to me. Listen with open eyes and open ears. If I inhibit tyrosine hydroxylase, see, let me make it here. Let me take another color. If I inhibit this tyrosine hydroxylase, guys, if I inhibit this tyrosine hydroxylase, you tell me, will the tyrosine be converted into dopa? Will the tyrosine converted into dopa? No, 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 no. Won't be converted into dopa. Let us make it like this. So which drugs inhibit this place? Which drugs inhibit this place? Mid-tyrosine. Mid-tyrosine. Fine. So mid-tyrosine inhibits tyrosine hydroxylase. Okay. So who converts Who converts this dopa to who converts this dopa into dopamine? Who converts dopa to dopamine? So dopamine is different, guys. Dopamine. So who is converting that? It is a non-specific carboxylase. Please write in your copy. It's a non-specific decarboxylase. Sorry, decarboxylase. So non-specific. It should be. You should know it from the biochemistry. Do we know that we had 5-hydroxytryptophan in the biochemistry? We were converting it to serotonin by decarboxylation reaction. Okay, fine. So remember that. So dopa converted to dopamine, same decarboxylase I'm talking about. Okay. So see, now I make another. This is dopa decarboxylase. Dopa decarboxylase. This dopa decarboxylase, if you inhibit, what will happen? Dopa will accumulate and dopamine will not be made. Dopa will accumulate, dopamine will not. So I will be giving which drug? Which drug should I give? Carbidopa. Today I am writing cute. Otherwise, I hate to write. Okay, because I keep on speaking to waste, don't not to spend more time on writing. Understanding is most important. But yeah, writing is also important to give you an image of diagrammatic view. So carbidopa is inhibiting this dopa decarboxylase. Okay. Now I had a transporter that is called VMAT2, vesicular monoamine 2 transporter. VMAT2 is actually bringing this dopamine into the vesicle. That's just the function of this. It is bringing the vesicle, these dopamine into the vesicle of, in this vesicle. Okay, they are putting it in the vesicle. That means if I inhibit this also, where to make its inhibitor? I should make it like this. So if I inhibit this, who will help me in inhibiting? It's reserpine, it's tetrabenazine, it's valbenazine, it's then what was there? Then tetrabenazine, isn't it? Which we use for where? Where do we use that? We use it for Huntington's chorea. Valbenazine we are using in which neurological disorder? Tardive dyskinesia. A beautiful concept it was really. So if you are inhibiting this VMAT2, what you will be giving? Who are inhibiting them? Reserpine, tetrabenazine, valbenazine. Fine. Is it clear? Who is converting dopamine to norepinephrine? Who converts dopamine to norepinephrine? Let me make it separately. Who converts dopamine to noradrenaline or norepinephrine? Who can tell me? It is called dopamine beta hydroxylase. I hope you have forgot everything. Yeah. Either you haven't read or you have forgot, but now today remember. DA. This is all interrelation. I'm integrating biochemistry here also. DA beta hydroxylase. Can you tell me a drug which is inhibiting this? Disulfiram. Disulfiram inhibits this. Disulfiram. Disulfiram inhibits this. Is it clear, friends? Okay. Now, if you want to prevent, okay, if you want to prevent, I should write another drug for you. Why to write this much only? Deutero. Was not actually deutero, otherwise I'm going into deutero. No, in the I. So it should be tetrabenazine. 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 These are all inhibiting. Okay, these are all inhibiting. Now see, guys, you are inhibiting this VMAT. What will happen? You won't be able to transport the DA like you had the Vesamicol in the muscarinic way, isn't it? What else can I say? What else? Yeah, I have to say about this vesicle when it's releasing. Okay, Now, if you are doing which process you are doing here, you are doing exocytosis. You are doing this exocytosis here. Exocytosis. If you want to prevent the exocytosis of noradrenaline, what you will do? You will give a drug. Which drug we give to prevent the exocytosis? Which drug do I give? This should be made in your copy very cleanly, because before exams or any time you can refer it. That's how I can help you. This is how I can help you. Okay. Exocytosis you have to inhibit. What you can give? Guan. Very nice. Guan, ethidine. Guan, ethidine. What else? Only guan, ethidine? Bretylium. Bretylium. You will give bretylium. Okay. Is it fine? Have you understood this diagram? Why I taught directly the blockers? There is a reason that you won't understand right now. Okay. Now, what is the difference between noradrenaline and adrenaline? What is the difference between noradrenaline and adrenaline? The difference is that we don't know, isn't it? This should be your answer. Okay. As being doctors, you should know there is a difference of methyl group. The reason noradrenaline is noradrenaline and adrenaline is adrenaline. Wow, what a beautiful biochemistry. Without biochemistry, you can't become doctors. Do you know it? Once you are reading glycogen storage disease, you are going into pediatrics. If you don't know biochemistry, you are gone. You are gone. You are not able to, revive from your brain how tyrosine I'm making, dopamine, noradrenaline. Then you are lost. You will be lost in pediatrics. Please revise this. I am giving you every subject here. Okay. That is the thing what I give in my lectures is I try to give from every subject. Okay. So keep noting it down on your notes. Okay. So you can also take the screenshot of this so that you can keep it in your in your revising in your book. I have drawn it neat and clean so that you can make it neat and clean also. Okay. So guys, I want to tell you basically this methyl group. Okay, let me discuss it. If you want to convert, that is the reason why your neurons are making noradrenaline. Why? Because your neurons don't have the enzyme. Which enzyme? They don't have the enzyme. Which enzyme? Phenylethanolamine and methyl transferase. Do you know this? Phenylethanolamine and methyl transferase. So this enzyme is making adrenal medulla hero. Adrenal medulla is hero. Hero bata hero, isn't it? Adrenal medulla is becoming hero. Why hero? Because he is having this enzyme. So what will he do with this enzyme? He is able to produce adrenaline. He is able to produce adrenaline. That's why conversion of noradrenaline to adrenaline is happening only in the medulla. He is having that enzyme in his cytoplasm. He is having his enzyme in the cytoplasm. That's why you are speaking noradrenaline. There should be a reason when you speak this noradrenaline. Once you say something, you should have in your brain. If I have a question, I should speak. I should be able to give the answer why it is noradrenaline. No, everything is for a reason there, isn't it? It's not that you will directly say something and it's not there. Something is there. Evidence-based medicine is there. EBM is there. So neurons don't have this enzyme. That's why they are producing noradrenaline. In adrenal medulla, the hero is having that enzyme producing adrenaline. Adding that, what is the function of this enzyme? He is doing methylation. He is transferring the methyl group. He is converting this into adrenaline by carrying out the methylation. He is doing methylation. This is the step of methylation. This is the step of methylation, guys. That's why your neurons, they say, oh, they say bus. What? Some people, some languages, we say bus. Stop it. I can't make adrenaline. I can only give you noradrenaline. What is neuron saying? Adrenergic neuron. Adrenergic neuron is saying I can only give you noradrenaline. I don't have this enzyme phenylethanolamine and methyltransferase. I don't have enzyme phenylethanolamine and methyltransferase. Phenylethanolamine and methyltransferase. Is it clear? Is it clear? That's why your adrenal medulla is able to produce adrenaline. Why adrenaline? Because he is having that methylation enzyme so that it can methylate that noradrenaline to adrenaline, noradrenaline to adrenaline. Is it clear, friends? Friends, is it clear? Are we in line or we are lost? Guys, I've tried to do my best to relate it. Now it depends on you, your revision. See, I'm can also take the screenshot. Okay, you can take the screenshot of this. So if you have seen in our ANS discussion video, in the beginning video, we have discussed the effects of parasympathetic system on the various organs, that is heart, GIT, urinary system. Likewise, we will be taking the same concept on the sympathetic system to remain easy, whatever we can understand. Okay. Now see guys, if I talk about the sympathetic receptors, I hope you remember the parasympathetic receptors, nicotinic muscarinic, and MM1, M2, okay. Now if I talk about sympathetic nervous system, sympathetic nervous system receptors, sympathetic nervous. Guys, are we understanding ANS or not? Is ANS tasty or not? First you tell me, is ANS tasty or not? Sympathetic nervous system receptors, sympathetic nervous system receptors. Okay, sympathetic nervous system receptors. We divide, please listen to me, please listen to me, please listen to me. Sympathetic nervous system receptors are divided into two: alpha, broad, alpha, beta, alpha, beta. This is how we learn at home. We open the book, we write on the notes, we learn, and we learn. Learning in organized way is key to success and achievement. Learning in messy way, reading 100 books from 100 sources and then not understanding is very much pathetic and is very much same thing like a dead user muscle. Okay, so alpha further divided into alpha 1, alpha 2, alpha 1, alpha 2. Alpha 1 further divided properly into alpha 1a, alpha 1a. See, I will tell you how to write. If I wrote here alpha 1a, if I wrote here alpha 1a, I should write here alpha 1b, alpha 1b, and alpha or 1d, alpha 1b or 1d, alpha 1b or 1d. This should be in the subscript. Okay, is it clear? I will write it clearly. Let me write like this: alpha 1a, alpha 1b or slash 1d. Okay, alpha 2, alpha 2 is alpha 2, no division. These are divided on the basis of location, on the basis of location, on location of neuron, whether they can be presynaptic, they can be postsynaptic, they can be presynaptic, they can be postsynaptic. Fine. Is it clear? Is there any doubt? There is no doubt, sir. Simple. Alpha, beta, alpha 1, alpha 2, alpha 1a, bd, alpha 2, presynaptic, postsynaptic. Okay. Beta receptors broadly, beta 1, beta 2, beta 3, beta 1, beta 2, beta 3, beta 1, beta 2, beta 3. Is it clear? So beta 1, beta 1. Now how we learn? How we learn, sir? Which receptors present on which place? People start crying in this. People start making 500 hours video on this. No need to make that much. Just remember one thing. I will make you write first where is alpha 1a present. Alpha 1a is present in, you can write below this. Okay, I'm writing here. I, urethra. Which urethra? Prostatic urethra. Prostatic urethra. Prostatic urethra. Okay. B for blood vessel. Alpha 1b. Alpha 1b present on blood vessel. Fine. Okay. Easy. Easy. Now presynaptic. Presynaptic means like this. This is synapse, and I take this as presynaptic. If I take presynaptic, I have presynaptic alpha 2. I have postsynaptic alpha 2. Where what is the function of presynaptic alpha 2? Presynaptic alpha 2, we call them as halt faucets. We call them faucets, means they stop. They stop the, for example, do you know the faucet? They stop the they stop that release, or they stop the sympathetic synthesis. They stop the synthesis. So if this is synthesizing, it is producing this. This is acting as a closed switch. This is acting as a switch, switch off. Once you stimulate this alpha 2, it will tell this neuron, don't produce anything. Don't produce, because the things are already here. It will tell him the things are already in the junction. The quantity has increased more. The activity has increased more. The neurotransmitter is already here. Don't produce more. Don't produce more. Don't produce more. Don't produce more. Stimulating alpha 2. Do you think that alpha 2 is important or not in regulating? Do you think that it is important in regulating the synthesis and production? Yes, sir, it is important, because we don't want every time that more and more noradrenaline to come. We want a stop switch, on off switch to turn off the. So what is the function of postsynaptic? Postsynaptic alpha 2 are present on your blood vessels. Remember that. Postsynaptic alpha 2 are present on blood vessels. Postsynaptic alpha 2 are present on blood vessels. They are present on blood vessels. And B for blood, B for brain. So alpha 2 is present on blood vessels and brain. Blood vessels and brain. Okay. Easy. Easy, guys. Easy. Now, beta 1. Beta 1. I want you, every time I have taught so many batches, my seniors also, I have told them to learn like this. Make a red pen. Take a red pen. Take a red pen, please. Have you taken? If you have space here, make a heart like this. Decorate it with beta 1. Decorate it with beta 1. Guys, decorate, start decorating, yeah. Start decorating beta 1. Have you decorated? All of the myocardium is richly having this beta 1. Myocardium, not specialized one. Is it clear? Have you decorated like this? Beta 1, beta 1, beta 1, beta 1 on the heart. Okay. And also write another example, juxtaglomerular apparatus. Juxtaglomerular apparatus, they also have what? Beta 1, beta 1, beta 1. I should remove this diagram here, okay? This synaptic. Fine. Understood? Now beta 2 is present where? Remember, beta 2 is present more or less, bronchus. I will let you know how to remember. First bronchus, then going from there, I should go where? I should remember blood vessels. Then I should remember GIT. Then what else? What else we have, guys? What else we have? This is about beta 2. Okay, don't forget. This is about beta 2. GIT, we have bladder, we have liver, we have skeletal muscle, and even uterus. Uterus is important. Uterus. Beta 3. Beta 3 is present on. Let me draw for you. Why it's not writing? Yeah. Let me draw it for you. Beta 2 is present on beta 3, sorry, it's present on the adipose tissue. I am making a fat droplet, okay? So this has beta 3, beta 3, okay? Adipose tissue. If I talk about the heart, I told you beta 1, but if I talk about the vessels of the heart, coronary blood vessels, let us make a medal on the heart. Coronary blood vessels, these coronary blood vessels have beta 3. Coronary blood vessels have beta 3. And if I talk about the bladder also, it has also beta 3. Beta 3. Now, sir, it's so much difficult. We have to remember gynecology, we have to remember pharmacology, we have to remember internal medicine, we have to remember surgery, we have to remember pathology. Sir, don't make this life so dangerous. There is a way to help you understand these things. How to remember? Remember, one way to remember is that situation of dog. Okay, that situation of dog. The situation of dog is that the dog, you saw the dog, what you should do. If I talk about the eye, what you should do? Should you increase the pupillary? Should you increase the pupillary to do mydriasis or meiosis? You should do mydriasis. So should the muscles, the circular muscles of the eye, should they be contracting or not? Isn't it? Yeah. Yes, friends, tell me. So that is one concept that you can understand. But to make it right now, to help you learn at home, so that I will explain it in the next lecture. Remember how many lungs we have. How many lungs we have, guys? Very nice. So what is the receptor on the lungs? Beta 2. What? Beta 2. This is one way my professor taught me. Okay. This is one way my professor taught me. Okay. In the first year only. Okay. Biochemistry teacher. Okay. He was a gold medalist in microbiology, biochemistry actually. Okay. From the prestigious Christian Medical College, Vellore. Okay. He was my teacher. So beta 2 is present on the lungs. Okay. So beta 2. Now, if he said 2 lungs, then I came in my brain, it came, I have one heart. I have one heart. So for one heart, I should have beta 1. Because one heart, so beta 1. One heart. So Nana has 2 hearts. She says 2. I have one heart. How she has 2 hearts? One heart she sends, another comes in the text box. That means 2 hearts. But I have one heart. I have one heart, isn't it? Okay. So your bronchus in the lungs, that will have beta 2, and my heart will have beta 1. Okay. Now let me give you a concept. See, what you are normally doing in the sympathetic activity, a general overview of your brain. Think, put your eyes, give an overview on the body. Look at the body from up to down. Are you generally, when the dog is after you, are you generally inhibiting all the things or not? Generally, are you stopping every activity? You only want to run. So are you inhibiting the other systems? Are you inhibiting the gastric motility? Are you inhibiting the urination? Are you inhibiting the, isn't it? But in the body, you are only stimulating the heart. You are only telling the heart to pump more and more and more blood because you want to run. So that means mostly you are stimulating the heart. Your heart rate is increasing, tachycardia. So that means your heart is getting what? stimulated. So mostly your sympathetic system is stimulating the heart. That's how you can remember that it is increasing the heart rate via beta 1. How? Which receptor? Beta 1. Okay. Now remember, wherever you find beta 1, something is there. What? Something is there. See, beta 2, I will tell you, whenever you are stimulating beta 2, whenever you are stimulating beta 2, think that things are going into, things are going into more on a, you know, relaxation side. Things are going on relaxation side. Things are going on a relaxation side. Like beta 2 is present on what? Beta 2 is present on, you will say yourself, I will not say, okay, to invoke in you the brain, I want to induce that. Do you want to relax the GIT in case of sympathetic activity, or you want to start contractions so that things will start going, so that things will start moving and you will start doing the same thing in front of the dog? Want to relax it? Do you want the uterus which is containing the fetus, do you want it prematurely contract before the labor starts, even at the 3rd month or 4th month, or you want to sustain the pregnancy for 9 months? You want to sustain the pregnancy for 9 months, isn't it? A natural pregnancy, beautiful pregnancy, you want to finish. That means you should have relaxation of uterus, or you should have contraction, because at least in labor we are starting the contractions. Contractions induce labor, isn't it? It's the contractions which start everything. So what about the sympathetic activity? Do you want more blood to the muscles or less blood while you have to run? Do you have more blood on your vessels to run? More needed. So do you want the blood vessels in the skeletal muscle to dilate or constrict? You want them to dilate. That means which receptor will you use? See, you will yourself answer. Which receptor will you use? Beautiful, guys. Beautiful. You are genius. We'll be using beta 2. We'll be using beta 2. Fine. So how to remember a blood vessel? We know alpha 1 causes vasoconstriction. Vasoconstriction. And what is beta 2 doing? Dilation. So alpha, it becomes something like A, C, B, D. So you don't have to write A, B, C, D. You have to write A, B, C, D like this. This is quite logical. Your brain can perceive it. So that means wherever there is alpha 1, there will be constriction. Wherever there is beta 1, beta 2, there will be dilatation. So you have to say A. A is having the position what in the alphabetical order? What is the position? 1. What is the position? A, B, C, D, E, F, G. Is 1, 2, 3, 4, 5, 6. So 1 with virtue of A is alpha 1. Beta 2 by virtue of position is beta 2. Alpha 1 will be doing what? Constriction. So I am not writing A, B here. I am writing it here. A, B, C, D. Is it clear? So in the blood vessels, alpha 1 causes constriction. Beta 2 causes dilatation. Beta 2 causes dilatation. It all depends on your imagination, guys. How you think, how you can learn. It is not taught. These things are not taught. It comes from your brain. Whatever I have my own mnemonics also. I'm telling you. Okay, I'm sharing it with you. But yeah, you should try your brain also. The mnemonic which you find by yourself is retained more than the mnemonic which is given to you. Okay, this is scientific, I can say. So how to remember the other receptors, how I remember them, will be told to you tomorrow in the next lecture. If you have not subscribed to the channel, please subscribe. I will be definitely helping you out to understand medical science. Whatever, how much I can understand, I will let you know that authentic. Okay. So I hope you understood the topic. See you all in the tomorrow's lecture. Take care and bye bye.